Hello, this is Dr. Allen Weg from Stress and Anxiety Services of New Jersey with a fourth and final installment on these video clips about how to speak to your child when they're at home with you and they're experiencing very high anxiety or having an anxiety meltdown. Once you've gotten them to relax a little bit and be grounded and to get a sense that you're there and that they're safe, focus really then becomes finally to find out, well, what happened, what's really upsetting them. The cognitive behavioral technique that we use as the psychologists at Stress and Anxiety Services is called downward arrow technique. We are basically asking a kind of a chain analysis. So tell me what happened first, and then what happened, and then what did you do, and how did that make you feel, and what did you do after that, and then what happened? And you're just getting a very specific narrative of what happened, what they did, and what they thought in the chronological order of those events, and trying to get a sense of what the story really was. And while you're listening to them, you really want to be reflecting what their experience is. And so what you're doing is you're empathizing with them. Oh, that must have been really scary for you. Or that might have been really hard for you. And then validate, where you're basically saying, oh, I can understand why that would be upsetting for you, or anybody would be upset if they thought that. So you're talking about really verbalizing their experience and saying that you understand that that would be something that most people might experience. It makes sense to you. So they really feel heard and supported and not judged as if they're just being silly or just overreacting. Ultimately, the goal then is to have them really figure out, well, what could we have done about this? What could you have done differently? Or maybe how could you have thought differently about this? And so what would be more calming thoughts during that particular time? And what else could you have done rather than the things you have done? So you're doing problem solving, both at the cognitive, the thinking, and the behavioral level. And ultimately, the goal is to make it so that if they have the same kind of concerns in the future, that they'll remember what you talked about here today. And what you're really doing is you're taking this situation that was very anxiety-provoking for them, maybe even traumatic to some degree, and making it a learning opportunity for them, and for you, a teaching opportunity as a parent. This is Dr. Allen Weg. Take care. Be well.